Welcome. Good afternoon. Thank you for spending the next hour with us today. We are going to talk about caring for the developing athlete during the COVID pandemic. We've put together a pretty diverse group of speakers to address a lot of challenging topics as we try to give you guys some practical advice to navigate through these very turbulent and uncertain times. So batting leadoff today with the talks is one of my partners, Dr. Lauren Redler. She did her residency with us at Columbia and then is one of the dual trained fellowship surgeons here in New York City. She did her sports fellowship at the Hospital for Special Surgery and then another year up at the Children's Hospital in Boston. Her passion is caring for the developing athlete, and she's got a little talk today on how to stay active during the quarantine. So Lauren, take it away.
Thanks so much for having me. So how to keep your kids active during this quarantine. This COVID pandemic has influenced everyone, not only adults and their jobs, but also our kids and youth sports. And so many athletes have said their winter seasons curtailed early, they're unable to play their spring sport. Sports are one way that keep us all connected. They keep us fit. They keep us, and me in particular, sane. And now thousands of athletes, whether it be baseball, softball, lacrosse, tennis, or track, find themselves with this downtime that they weren't expecting just a few weeks ago. Parents all over the area and all over the country are asking, how do we keep these kids active and how do we keep them involved in their sport during this time? What should their focus be on? We know that children and adolescents need at least 60 minutes of physical activity every day, and preschoolers need even more with up to 180 minutes a day. You definitely don't need any fancy equipment to be active, but there are certainly some activities that we would hope that your kids are avoiding, like this trampoline jumping off of a roof. I'm going to go through a few activities and based on age and based on sport to give you guys some ideas of how to keep your athletes active. What Moms Love is a great website that has a ton of activities for all ages, but particularly younger kiddos. They have activities for both indoor and outdoor activities. You can try using some of their ideas and motivating your kids with challenges such as, can you find X? Or how far can you Y? You can play hide and seek with them, make an obstacle course in your house or in your backyard, ride bikes, play hopscotch on the sidewalk or in the hallway of your apartment building. Have your kids make up a jump rope routine to their favorite song. There's lots of different activities that they've got suggested on here. This one is one of my particular favorites, a balloon tap. This suggestion is blowing up a balloon and taping it at a height that's just above where your kid can reach and have them jump and see if they can reach it after working hard. There's lots of different activities on YouTube, especially for young kids. This is a great one that's a HIIT type workout for little kids that's based on animal activities. This helps improve their gross motor skills, their balance, and the coordination, and will help them prepare for sports in the future. Another great option for a wide range of ages is Cosmic Kids Yoga. This kept my 2-year-old engaged for at least 25 minutes and my partner's 8-year-old engaged for the entire time. Frozen is, of course, our current favorite, but they have a theme from every movie imaginable. Dance with Miss Rachel is another great option. Dance is a great way for kids to get their energy out. Dance with Miss Rachel has studios on the Upper East Side and Tribeca of Manhattan. And of course, they're currently closed, but they're doing on-demand classes on their website, as well as daily live virtual classes on YouTube. Go Noodle is a popular classroom favorite, and your kids may already be familiar with this. And they've partnered with NFL's Play 60 campaign, which is encouraging kids to get physically active for at least 60 minutes a day. And they've got lots of great videos online, like this one from Ryan Kerrigan, focusing on some lateral movement. It's about 10 minutes of exercises that might have one of your children's heroes leading them through their activity. One of the best activities that I found was by this blogger called Christina Toddler Approved. She has 4 kids that are ranging in age from 3 to 12, and they all loved this activity. They started by making these running cards, punch cards, and then they set up a running course. They have the benefit of living in a neighborhood, but you could certainly set this up in your apartment hallway. They have a course with cones, but you could also use tape, and each lap around the course earned the athlete a punch, and the kids love the punching part too. There's lots of great at-home fitness workouts. Gyms are closed all over the country, but there's lots of online things that you could do to keep your children fit and healthy. Peloton's a great option, and they've actually made their platform free for 90 days, which is an increase from the normal 30-day free trial, but this does end in 2 days, so make sure you guys sign up soon. They use metrics. It allows you to challenge yourself. You can earn certain achievements, and I think this gamification of physical activity is really motivating and really engaging and keeps kids active. They even just came out with their Fit Family classes, and this has a wide range of activities, including family fun classes that are short and geared for ages 5 and up, strong classes that are more focused on strength that are a little bit longer and geared for older kids 10 and older, some brain breaks that are just a few minutes, and then some meditation classes that are great to do as a family as well. Similar to Peloton, Nike Training Club has also waived their fee for their monthly service indefinitely, and they have a huge library of classes including yoga, cardio, HIIT classes, and strength training, and these could be beneficial to athletes of all kinds, not just any one particular sport. Here are a couple of other free options to keep your kids active depending on the activities that they like. Daily Burn is some more strength training and HIIT type activity. Core Power has yoga classes. Berries is a boot camp type class, and Rumble is boxing. And these are all offering free classes, on-demand classes on a variety of different platforms. Many high schools are also being really proactive with their athletes. Here's an example of an at-home workout that the Hackley School in Terrytown sent to their high school players. This includes a warm-up followed by a Tabata workout and then a cool down. And this could be helpful for a lot of different athletes during this break. Now I'll go into some more sport-specific ideas. There are lots of ways that you can connect with the game of baseball and softball at home, and Play Ball is part of the Major League Baseball's effort to get kids active. They have a lot of different content to get kids involved, whether it's learning some drills, viewing the sport in different ways to play, or just interacting with the teams and players. It's, staying engaged with the sport of baseball. Downtown United Soccer Club has lots of useful content on their Instagram account, and they've been hosting live Instagram sessions with soccer drills like this particular one that was just yesterday on ball mastery sessions. Soccer players also have the ability to work on some ball handling drills at home. This is an innovative product called Dribble Up. They also have an innovative basketball for dribbling skills as well. And these can both improve players' footwork and handwork and ball control skills. One drawback, however, of course, is the cost. Kids all over the country are getting super creative in the ways that they're staying involved in their sport and combining their interests. You can create these challenges with your kids. This could be a combination of a obstacle course that you set up and their sport. And this could be obviously in the home like this video, or it can be outside as well. All lacrosse players will know and love wall ball. I know this was a huge part of my days playing lacrosse. It's a great way to practice a lot of basic techniques, such as shooting, passing, catching. You can get a ton of repetitions in, and the best part is that you don't need a partner. You can work on weak areas like left-hand passing, and no one has to be there watching you. Cradle Baby is an interesting product that I came across in researching for this talk, and it's a regulation lacrosse ball that's tied with a tether to the top of the stick, so players can work on throwing and catching without the need to have a partner if they don't have anybody there to play with them. Just as important as maintaining skills and staying active during this sport for your child during quarantine is staying connected to their teammates. My alma mater, Georgetown Lacrosse, is doing a great series for their seniors who are missing their senior spring and giving them an opportunity to share thoughts on what the sport means to them with the Dear Lacrosse series. So for lacrosse players in particular, I think this is a great way for them to stay engaged in the sport and see what college lacrosse players are doing. It's also important to stay connected to their teammates with Zoom conferences, FaceTime. Remember why they love the sport that they play and realize that they'll be back doing that sport one day soon. Now I'll leave you with a quote from one of the greatest movies of all time, Field of Dreams. The one constant through all the years has been baseball. America has rolled by like an army of steamrollers. It's been erased like a blackboard, rebuilt and erased again. But baseball has marked the time, and it reminds us of all that once was good and will be good again. Thank you.
Lauren, thanks. It's a great talk. While we transition over to Dr. Baptista Nieto, just a question for you. With regards to hours of sport a week, do you have a recommendation for as far as mixing indoor and outdoor? I know that usually we try to say you shouldn't do as many hours of sport a week as the kid is of an age, but do you have a recommended indoor-outdoor mix during this pandemic?
I think the greatest thing is that obviously the weather is going to control a lot of this, and there are a few nice days a week so far during this quarantine, and so getting kids outside during those days and the mix of some indoor and outdoor will give your kids a nice ability to cross-train, use some different muscles, maybe focus on different aspects of different sports, but they don't overtrain during this period of rest. So maybe no more than half of the days outdoors doing any specific sport.
Fair enough. I want to present our next speaker. Lou Baptista Nieto is an associate professor here at Columbia. His expertise is in child and adolescent psychiatry. We all miss sports. There's an emptiness, and a lot of young athletes have their identity wrapped up in their sport, and they can't play it. We got a lot of empty baseball fields, tennis courts, and lacrosse fields. So we wanted to get his take and advice on how to keep kids happy during these depressed times.
Great, thank you. Can you hear me okay?
Yeah.
Thank you so much. And thank you very much for being here, with us this afternoon. So you must be thinking, what is a psychiatrist doing here today? So, I work with children, adolescents, and adults at Columbia. But probably what qualifies me to be here with you today is that I have two teenage boys that play soccer competitively, and they're driving me nuts during this quarantine. So I can share with you, a lot of the challenges that that is going on. So I have only 3 talking points, and I try to go over this, briefly in the next 6 or 7 minutes. I want to talk a little bit about, some of the stress reactions that we should expect during this time in pandemics. Trying to differentiate stress reactions to depression as a condition, as a medical condition, and just briefly talking, about adaptive coping. So basically, when we're talking about a stress reaction, we're really talking about, really trying to adjust and adapt to a new reality. And if we think about us, arguably, well-developed, mature adults with adaptive coping styles and skills, we're struggling, in different ways, some days better than others. But, there is, some degree of anxiety related to the uncertainty and stress and frustration. So if we think that us as adults, are going through this, then we can translate that into a kid, an adolescent, young people that have not necessarily developed, all the adaptive coping strategies and skills to deal with it. So if we start from the baseline pre-COVID, right? And I think Dr. Popkin was alluding to that. If we think about a young athlete, right? So you have a pretty regimental routine. You build your identity, around, your sports. Gives you a sense of purpose that drives self-motivation. You have a sense of belonging, whether it's to your team, your community, your school, gives you status, and gives you a huge, outlet. You basically burning steams and being physically tired on a daily basis for hours, a day. And all of a sudden, everything is put on hold, right? So if we think about that, if we go back a few weeks, the initial phase of adjustment is really similar to a grief reaction, being grief a reaction to loss. And if we think about our young athletes, we're putting on hold their routine, the familiarity of their routine, the structure, the identity, the sense of purpose, right? That will affect the self-motivation, this feeling of belonging, the disconnection, and certainly they lost, one of the main outlets to manage stress on a day-to-day. So in a grief reaction, often, the initial reaction is one of shock and disbelief. Everything feels a little bit surreal. We're waiting for the kind of war to be over in the next, week or so. As time goes by, that doesn't happen, right? We started to experience different, emotions, anxiety and fear and anger, and eventually some degree of sadness, and that all goes in all these different directions. Eventually in this process, we get into a place of some degree of acceptance of this new reality so we can move on. I think the challenges that we have is that, one, the situation is still evolving, right? There's still a lot of uncertainty about when and how this will, end. And also In addition to that, right, there's not being a lot of time, for people to really being able to adjust. So it's very common in kids. I think adults can regress. So kids and young people are more prone to regression with less structure. So I think it's expected that we're going to see some degree of regressed behavior, young behaviors that we haven't seen before, especially for younger kids. But this is really a moral insult to our athletes. We're just pulling the rug, right? So we should expect some degree of frustration and anger, about why this is happening, to me. But, regression also often includes some degree of, less of a motivation, becoming less disciplined. You're going to see the anger, the irritability. It's okay to see some degree of sadness as long as that sadness is not persistent, it's not prolonged, they're able to rebound, quickly. So all those emotions are normal and expected in a situation like that. But then there's another layer, right? In addition to that, right? If we think about their baseline, we just put everything on hold. They're kind of a little bit regressed. They're reacting to all those perceived losses. And then all these other factors that might be related to the pandemic, whether it's losing a loved one or somebody who's close who has been very sick and very scary. So it's a lot that they're dealing with. I think the good thing is that, athletes are very resilient, right? Kids in general are resilient, but athletes, they're used to have a regimental routine and have high expectations and pressure and physical pain and fatigue. So they're very resilient, and most kids, most youth, they'll do okay. So with some degree of reaction. So one I think the important things is trying to differentiate what is a expected and manageable reaction of stress and regression versus something that might need a little bit more of attention, like depression. So depression is a clinical condition and is a medical condition who needs treatment. And there's well-defined diagnostic criteria for depression. You need to have 5 or more symptoms for at least 2 weeks. It's clearly affecting the ability to function or causing significant suffering or distress, and cannot be explained by other factors, medical conditions, medications, or an acute phase of bereavement. In common symptoms of depression, and that is also true in kids and adolescents, includes irritability, anger, boredom, sadness. And very often in young people, we see more irritability and anger than we see the typical sadness. So sometimes parents can be confused, like, how can my kid be depressed if I don't see the sadness? But irritability and anger is very commonly seen as the mood state instead of, the typical sadness. Decrease in energy, changes in sleep, ability to fall asleep or stay asleep, change in appetite can go up or down significantly, lower motivation, lower ability to enjoy things that people normally, are able to enjoy, less concentration, and even thoughts of death and dying. Even kids can have it during the course of a depressive illness. So this is always a red flag, thoughts of death and dying that really require, more exploration, whether it's through your primary care physician or, reaching out to a psychologist, psychiatrist. Everything's done through video nowadays, so you don't even have to leave your house. But it is important, to always respond to that. Now, in terms of, building resilience, adaptive coping, I mean, we can spend an entire hour talking about this, but just as a guiding principles. One, for all of us, but how can you help your kid? One is acknowledging the challenge. Try to fight it. Try to, deny it. It's not going to help us. It's not going to change the reality, but it's not going to help us go through it. And kids can be pretty stuck and pretty rigid, into this situation. So some degree of acceptance is going to help them develop some flexibility to then adjust to this new reality. And very often during stressful times, it's almost like we forget our usual ways of coping, become paralyzed. And it's normally easier to try to access the old, more familiar coping strategies that work for us than trying to develop and use new ones. We can do both, but I think in the short term, it's easier to access old ones. So go back and look, what do they usually do in their routines that normally help them relax, have a good time, decompress? I know the sports is a big deal and we can't have exactly the way it was, but what else? Music and playing games, meditation, connecting with people. And the key issue is to be intentional, is really trying to canalize the natural abilities that the young athletes have to be driven and disciplined now into this new reality and start, scheduling some of these issues into the, these factors, these behaviors into day-to-day routine. We all, tend to focus on what we cannot control during crisis, and that we can just go into a spin. And kids and adolescents can do the same. So how can you be a coach at that point and really trying to move them forward and help them understand there's a lot of things they can control right now. And if they focus on that, I think it's going to help significantly more. It's going to give them less of a sense of frustration and powerlessness and help them cope. And I think avoid the all or nothing trap, right? And kids can get into, well, if I cannot practice 3 hours a day the way I did, I'm not going to do anything. So how we can really try to help them to, exercise some more cognitive flexibility. 30 minutes a day is better than nothing. Maybe you can build to that build from that. So your kids better than anyone else. Trust your guts, engage them in a ways that normally works for them, trying to follow some structure. And most kids will do well. But if you feel that something doesn't look right, doesn't feel right, reach out to, any one of us, reach out to your primary care physician and, try to get some of the questions that you might have answered. I'm going to put on the chat my email. And if you have any questions, feel free to reach out and I'll do my best to answer them. Thank you.
Dr. Bautista Nieto, thank you for your talk. I guess a burning question I have is, what would be some red flags for parents and coaches to be looking for in kids that maybe aren't coping well or aren't building resilience, where they may need to contact a psychiatrist or psychologist like you?
Yeah, no, this is a very good question. I think, is anything that seems to be out of the ordinary for the usual way of coping in terms of severity or persistence, where there is a sustained level of irritability, or anger or sadness, being withdrawn, not being responsive, not sleeping, not eating, anything that seems to be out of the ordinary, persistent, in more intense and severe. I think it's always good to ask the question and trying to reach out and have an assessment done. Certainly there's major red flags like thoughts and comments about death and dying, and those definitely need to be, followed through.
Not exactly on the sports realm, but certainly relevant for adolescents. Any advice for parents out there for kids who have prom canceled on how to deal with that? Is it worth it to do a virtual Zoom prom?
I think we all live in this new reality. It's never going to be the same than being in a room with your friends and having a good time. But again, it's really trying to avoid the all or nothing and trying to make the best out of what we have available. And certainly seeing people in real time, like we're able to do that right now, can be very meaningful. And you still can have fun, that way. So yes, I think we have to be able to model that, we have to adjust and accept the new reality and help them, do the same.
Okay. Thank you very much for your time. We're going to transition over to Dr. Natasha Desai. Dr. Desai has been an awesome addition to our department. She brings a really unique perspective to this webinar. In addition to being a sports medicine physician, she is actually emergency medicine trained, having done her residency across the street at Mount Sinai. She's been the team physician at Columbia now for many years, and I've enjoyed covering some football games with her as well. She brings a lot of expertise, and we wanted to have her come on to specifically address for parents out there when you need to come to the ER during this pandemic. So Dr. Desai, take it away.
Thank you. Thank you guys all for tuning in. Nice to talk about some important things during this pandemic. So when should we go to the emergency department? I know we're all avoiding care and avoiding unnecessary interactions when ever possible. So when is it appropriate to go into the emergency department? So why do we avoid the emergency department in the first place? Before COVID, people used to avoid it because of long wait times. Some people perceive the emergency department as uncomfortable. It's kind of sterile. It's doctors that you don't know. It can be very scary for kids. And then I hear it all the time. The ER didn't do anything for me. People get frustrated because they come in expecting their issues to be addressed from A to Z. When what usually happens is the ER provider rules out any emergencies and then sends you home with either pain medication or a specific follow-up plan. So with all those already as factors of not wanting to go to the ER, with the COVID pandemic, we're also avoiding unnecessary exposure to ill patients. We've been doing such a good job with social distancing that why expose ourselves if at all possible to avoid. And then also we want to avoid crowding the emergency department, so to leave the providers available to care for those that are truly ill. That being said, there are emergencies that happen that are non-COVID related and need to be addressed. So what are these? So anything that requires surgery or a procedure is obviously something that may need to be addressed emergently and should not wait. Emergent reduction of a dislocation or a need for realignment of a fracture are good examples of that. If your child sustains an injury that has a large wound or a laceration or something that needs to be looked at, that it is a legitimate reason to go to the emergency room. Also, anything that there's a concern for neurologic or vascular emergencies, and I'll go into some signs of these a little bit later. Lastly, if there's any chest contusion or anything and the child is having trouble breathing, those are obviously concerns as well. If you don't think your child has a true emergency, but their pain is out of control, and you've tried things like Tylenol and Motrin, and it seems like the child is truly suffering, that's not a reason to avoid the emergency room. It is prudent to bring the child into the emergency room, get the pain under control to get that assessed. And lastly, any parental or provider concern. The emergency department is open. It's ready. They're ready to take care of you. Don't hesitate if you believe something is wrong with your child or with you. That comes first. So I'm going to talk about some specific orthopedic issues and reasons why you go to the emergency room. One common concern is head injuries. Our kids tend to bump their heads a lot. Usually, thankfully, most are minor, but I do want to point out some red flags for you to be concerned with, especially things are going to be down because there's no contact sports right now. But if you're taking Dr. Redler's suggestions and playing all these sports inside, there may be a little bit more bumping into things. So what are the immediate red flags that you may find? One is a true loss of consciousness. If they close their eyes and open them right when they hit their head, I don't really qualify that as a true loss of consciousness, but if they truly pass out or get knocked out, even for a short period of time, that should raise your level of concern, especially if they don't remember everything. If there's any large wound, if you notice any convulsions or any seizure-like activity, while you can have a couple convulsions with a minor concussion, it's still prudent to get that addressed and get that evaluated. Any neurologic signs like slurred speech, weakness, numbness, vision changes. Sometimes later, while you're watching, you're making that decision whether you want to take the child in. Something that is a bad sign is repeated vomiting. One time, immediately after a head injury is very common and very expected, but if they continue to vomit, that can be a concerning sign. Any confusion, agitation, unusual behavior, that shouldn't really be happening, so that is definitely a concerning sign. Sometimes the child could start out with a mild headache and it could progress and get more and more severe over time, and that is also a concerning sign. And hopefully you don't see this as something more late finding, but anytime one pupil is larger than another, that is also a red flag to look out for. All right, so in extremity injuries, this is where we're looking for like neurovascular issues. So if you notice that the extremity is cold or numb or the coloration is a little bit off at distal to the injury, then that could be something concerning, especially if there's a deformity at the site of the injury. If they're unable to bear weight right away, that's a concerning sign. Usually after a while, especially when swelling has developed, you may progress to the point where you can't bear weight on the arm or the leg, but if immediately you're not able to bear weight on the arm or the leg, that is a concerning sign. And back to the original point of any severe pain that can't be controlled with Motrin or Tylenol or something like that, that's definitely something to be addressed. You can consider waiting if, you know, you're able to range the joint. They will have pain, but if it's not so bad, if they were originally able to bear weight, not immediate swelling or immediate bruising or anything like that, you may want to consider waiting for an outpatient telehealth visit. So if you're unsure, one of the greatest things that came out, one of the silver linings of this pandemic, is that we finally harnessed the potential of telehealth. We are able to bring healthcare to you in your homes right away. And Columbia Orthopedics has definitely embraced this full force. If you're unsure, you could always call us or set up an appointment through the internet, and we're able to get same day appointments. One example of this is just the other day, I had a 12-year-old boy. He fell down, landed on an outstretched arm, had some wrist pain. I was able to see that there was no obvious deformity. There was a little bit of swelling, but nothing too concerning. And I had mom press on the areas, and I was concerned about a distal radius fracture, something that, you know, you could very easily go to the emergency room for, and no one would fault you for that. But we were able to get the mom to get an over-the-counter brace from a local drugstore, and then sent them in for an outpatient in and out x-ray, and set them up with our orthotics person and got them into an appropriate brace, all without having to go to the ER, being exposed and all of that, and all within 24 hours and all very safely. So a lot of these very minor fractures, but minor injuries can be addressed via telehealth. And then if you're not sure and it's off hours or weekends and you still want more information, the emergency department at NYP actually set up a virtual urgent care, which is a very cool resource where 8 a.m. to midnight, 7 days a week, there is emergency providers there to do telehealth and to help you make that decision if you need to take your child into the emergency room. So that's it for me. Again, this is the contact information if you did need any telehealth visits, and thank you for listening.
Dr. Desai, thank you for your talk. Very important one, take-home message. Dr. Levine even typed it in there on the chat. It is important to get the word out that you should not avoid the ER if there is an emergency. So important message there, and thank you for sharing the contact info for people with how to set up that appointment. Thank you. A couple of housekeeping things. We keep getting questions if the talks will be available. Yes, they will. They'll be on our website, and we will also email a link out to you with all the talks, so you don't need to scramble down and take notes and things like that. So thank you, Natasha. I think that's a good segue to transition to Joe Saccone, who is one of our all-star physical therapists, and he is going to talk to us about telehealth physical therapy and the available options that we have to offer with that.
All right, so I'm going to be kind of piggybacking off what Dr. Desai alluded to earlier and talking about telephysical therapy and how its role has kind of come to fruition now. So typically we used to our sports performance center up in Scarsdale and Westchester, and obviously things have changed now. And like Dr. Batista alluded to earlier and spoke very well about, was that this can be a very stressful situation. Kids and athletes worried about getting back to back to health. And it can be an emotional response to this, especially if you were in the middle of a rehab, especially post-operatively. But now we've kind of moved on to telehealth. So it's really the ability for us to talk on our phones and our iPads so we can interact with all patients. So, and things have really changed quite quickly here, and using this technology really gives us the ability to reconnect with our patients and also connect with people who need services now. And it allows us to improve the access, which is great, because having early access to a physician or a surgeon or even physical therapy can really be critical in someone's recovery. And we're doing this over real-time video with physical therapy as well as the other services, and really a lot can get done. So what are we seeing? I'm seeing a lot of surgeries, post-op patients, people who were just got injured. We're seeing a tremendous amount of sports injuries still. And we're also dealing with like kind of the tail end, programming and getting kids back into sport, which I believe Dr. Ahmad will speak about a little bit later. So we have a team of specialists here, and we're really utilizing all of our experiences and skill sets to still come up with the best treatment plan. So there's a lot of communication going on in the back channels with getting referrals and what the physicians think is going on and how we can best treat it. And we're using all these clinical reasoning skills and pattern recognition skills to come up with the best treatment plans. And within that, a lot can be done. Even though we can't physically touch a patient and get an assessment, there's still having them guide them through palpating and touching certain areas so we can get some information. Even some simple special tests can be done too. And we're using a lot of functional movements for physical therapy. Again, this is in one of our squat racks, but you can just simply do this in front of the camera and get an idea. You can get a lot of information about flexibility, mobility, strength, just from simple videos like this. This is one of our Yankee players that we rehab in clinic. And the thing is, just from video, whether I'm in the clinic with this patient or not, I can still get my information with them. And then this would be, after an intervention, and again, assessing, reassessing, treating, and it's a constant evolving thing that we have going on. So this is another example just for lower extremity. This is a post-op ACL patient. Again, he's using some e-stim, which can still be available sometimes over the counter. But this is, again, getting an idea of how someone moves, coming with a treatment plan, and this is about 6 weeks later. So progress can be made. And the great news is a lot of these musculoskeletal conditions can be treated successfully utilizing telehealth PT, because a lot of it doesn't have to be us actually doing something. We don't have to be doing soft tissue work or doing mobilizations, things like that. A lot of it is communication and creating movement-based activities, strength, stability, balance. A lot of it is education. This is just some quick examples here from some morning sessions I had, and I got approval from the patients to post these. But this is a post-op patient from Dr. Ahmad, shoulder, Division I college baseball player, who was kind of on the tail end of his rehab when this whole COVID thing happened. And, we're getting creative. So, we're doing some ball slams in here. He actually built a pull-up bar in his backyard with all his spare time. Thing is, he built it about 3 feet too high, so it's about 10.5 feet. So he's using a ladder to get up there, but it still works out great. This is a post-op hip labral tear that I did a session with her this morning. And again, just me being on a video there, I can see how she's moving. I can see if we have to progress or regress. And it really it helps a lot, not only for me to get good information, but also for them. It creates structure. It creates a good feedback loop so they know what they're doing is right. They don't feel lost in the shuffle. Now, a big question that always pops up is, what if I don't have all this equipment? Well, you don't need a lot of equipment. This is just an idea of kind of pounds using water, using a lot of elastic bands. I had a kid today, throw a bunch of books in his backpack and use that for weight. So we're getting creative. It's very simple to find things around the house to utilize to still make solid gains. And we're making solid gains with high-level athletes too. I saw an NFL earlier last week, and we were able to do a lot of great work, even just from simple household stuff. So what are the perks here, right? Well, one, we get to work with our specialists regardless of location. So we're really eliminating the logistical barriers that we typically had to deal with. There'd be people coming in, a few hours out to, across the country to have surgery. And then, our surgeons want us, because we're the specialists in dealing with certain components of that surgery, certain niches, they want us to see them, but it makes it very hard logistically. But now we have the ability to do that. And I think it's really going to progress into the future about how things are done. So, and it creates a huge opportunity. So one of the first things is now you can take us anywhere with you. So typically we're always seen in clinic. Now we have the ability to kind of go on field. Actually, this is again, me throwing on the field with a player, but later this week, I have a scheduled appointment with a father and son, a kid who's coming off Tommy John elbow surgery and who was just getting ready for throwing. So they're going to bring the iPad to the field, set it up. We're going to go through a warm-up program. We're going to go through some exercises and have him throw. So now I can actually be on field with him, see how he's throwing, look at his form, make sure it's not too intense. And this can carry over from baseball, and we can do football drills, basketball, soccer, lacrosse, field hockey. I mean, we can really take it anywhere. And even things like, going on vacation, now you can take us kind of with you. And so there's always a continuum of care, and there's not these big gaps that sometimes happen and can stress people out as well. And I just put this slide in because I just want to reiterate the fact that, even though it's one-on-one session, it's still kind of a big team affair where the surgeons and I are in constant communication. I really think that's what separates Columbia as far as treating a lot of our patients. So in summary, really we have the ability to provide expert care really in the palm of your hand. We can be taking things from a clinical setting to the home or the field or wherever. We can get creative with treatments, and it really just gives us another way of staying connected so that we can keep progressing, getting people back to where they want to be. Thank you.
Joe, thank you for your talk. I guess my first question would be, if we have patients out there that want your services, what's the best way for them to get an appointment with you?
Sure, I'll post the direct numbers that everyone can reach out to us in the group chat.
Fair enough. And then another one, you did an example of rehabbing after Tommy John, which is certainly a challenge. Looks like you got some good answers for that. What about some of the later phases of ACL rehab?
Yeah, so it's funny you said. I just had a follow up with a kid who's about 8 months out, who I haven't seen in about 4 months, and I actually took him outside, and it was a beautiful day out today. So he had some big steps, and he had a jump rope and a couple dumbbell weights, and we were able to go through some high level exercises together and provide a lot of feedback. Again, since we're on video, we can still do reactionary drills, things like that. So I was firing out exercises, kind of rapid fire. This way we work on conditioning as well as kind of more of a sport-like environment.
Fair enough. Joe, thank you for your time. We're going to, no problem, over to my mentor, Dr. Chris Ahmad, guy who really needs no introduction. He's our chief of sports medicine at Columbia. He is the team physician for the New York Yankees, as well as the NYCFC soccer club. He's one of those guys that just being around makes me want to be a better doctor and surgeon. And he's one of those I would certainly pay to hear speak on just about anything. So this one's free, so good for everybody. And he's going to actually talk about a really challenging issue, which is how are we going to return to sport in the COVID era, from Major League Baseball on down to Little League. So Chris, take it away. Drop some knowledge on us, please.
Thanks, Charlie, for putting this together. And for everybody who's on this webinar tonight, I want to say thank you, and I want to say best wishes to anybody who's been impacted either directly or indirectly by the pandemic. Let's start with pre-COVID issues, because that'll set the stage for how we're going to deal with our COVID environment. This kid first came to me when he was 10 years old. He tore his ACL playing soccer, and he needed reconstruction. And before we were in this last few weeks of COVID, all our attention in this age group was directed at, can we prevent injury so that this kid doesn't have to go through surgery and all the trauma with missing sport and everything involved with surgical recovery. And because of that, many of these kids, in fact, don't even return to soccer or their sport because of the psychological issues, fear of injury again, or fear of poor performance. And when we're feeling that we've reestablished and surgically made a new ACL, we may not have safely returned them to their sport because something was existing that allowed them to get injured in the first place. So we've been heavily involved with trying to find out what are the reasons for ACL injuries and then developing some screening. Here's this 10-year-old who tore his ACL, and we mentioned that ideally we would have prevented this injury and not had him go through all of the challenge of surgery and recovery. And so having gone through the surgery and fully recovered and has a brand new ACL, does it make sense to let him go back to sport in an environment where he could get re-injured? And many of these kids psychologically choose not to even return their sport. That's how impactful this injury is on some of these kids. And so what I was just describing, here's a young athlete. We are screening for ACL injury risk so we could hopefully avoid the injury in the first place. He lands beautifully. His whole body absorbs the energy of his jump. His knees do not come together, indicates he has very good hip control. He's like a cat landing softly. This is somebody who we're worried about. You could see her knees were banging together, indicating poor hip control. So the force through her knee with a subtle land like that could put stress on the ACL and cause an injury. And thankfully, if we can screen, and you saw there, we can screen players and athletes at a sideline and not in the office. And in fact, we've researched that athletic trainers, even parents, can get accustomed to screening risk like that with this simple drop jump test. We now have an opportunity to prevent injury. This is the FIFA 11. I'm not going to go through it in detail, but this program, which is about 10 minutes of exercise before a training session, can significantly reduce ACL injury. Here's what happens if you have ACL injury, unfortunately, and while we're trying to reduce it, if you need surgery, we can rebuild the ACL. And then our next challenge is, when do we allow athletes to return to play? Traditionally, with a time period, if you had 6 months of recovery, your ACL would be healed and you were considered ready to return. Unfortunately, you may not be physically ready to return. You may not have all of your proprioception or your strength in certain movements. So we designed what's called a functional assessment. This is a test that an athlete goes through following injury or surgery, and it determines if they are ready to go back to sport. Here's just a snapshot of what athletes will do during a session. It's Joe Saccone, or one of our therapists, who do this assessment, and there's a lot of hopping, jumping, skipping. And what we're getting at is, if you can do this, that means that the stress on your knee is ready and it's going to absorb stress with risk to your ACL. And you can see green, yellow, red. If you score red, that means you're not ready. Yellow, you definitely need work and you're not ready. And green, you're good to go. This is some data. It indicates that if you fail that test, the chance of re-injuring your knee could be as close as 40% when you get back to playing a sport such as soccer. But if you pass, it's dramatically reduced. It's not zero, but it's dramatically reduced. So this is a big new tool for us. So you pass the functional test. Kids will come in with their parents and they got their uniform on, they got their shin guards on, and now they feel like they're ready for the weekend game. We need to progress them almost like a preseason to get ready for a game. And that starts with limited practice, full practice, and competition. We've outlined this. We've made return to sport protocols for soccer, baseball, lots of sports, to give guidelines on how to come back. This is what it looks like in a professional athlete coming off injury, not ready for full training, but doing sport-specific drills that employs agility, endurance, and these are the first steps on getting back. Here's an athlete with NYCFC. Unfortunately, he tore his ACL and required surgery. He went through the same functional assessment that we offer all our recreational athletes. He went through all of the hopping and the jumping tests, passed, and then he went through sport-specific progression. And once he passed the sport-specific progression, he could get back in full training and then in game situations. So now, how do we give the professional athlete what they're offered, the same the same treatment analysis and evaluations to our non-professional athlete, our competitive athletes, that's specific to their sport, their age, understanding risk factors such as their gender or other injuries that they may have had, and how do we give them access? Well, we opened a performance institute in Eastchester to do just that, and that is give the same care that professional athletes have access to our high school, college, recreational athletes, and our organized sports athletes. And this is what it looks like in our sports performance center, where the physicians are one side seeing patients, the therapists are on another area, they're doing their physical therapy, and we have strength and conditioning getting our athletes ready to return to sport. So the typical jumping drills that you saw our high-end athletes doing, now we're doing it in a very advanced performance institute. And it's very common for me to walk out in between patients and see how recovering patients are doing in either physical therapy or in their strength and conditioning. And we could even throw in some sports specific work so that they start to feel like they're back to their sport and being the athlete of what they want to do in their goals. So let's not forget throwers, because they're extremely challenging. And the same functional assessment, Joe Ciccone, AJ Yenchak, our physical therapy team, and a lot of our specialists got together and created a throwers assessment. So if you've injured your shoulder, your elbow, and you want to get back to throwing, it's not enough just to get an MRI scan and go through a period of rest. You need to rehab, and then you need to be assessed to see if you're actually ready to start a throwing program. And similarly, they get the green light, the yellow light, or the red light. And if they don't pass, they continue to work on the deficit so they get better. Is this complicated? The answer is yes, it's somewhat complicated. Is it important? There are many of you who are on this call. These are some of the clubs that we have relationships with that we offer this type of care to, and we're continuing to expand it. These are academies that are involved with the New York City Football Club and affiliated soccer clubs located through the tri-state area. You can see the number of athletes. How about COVID issues? Does it make it more complicated? The answer is yes. You know that. Is it much more complicated? The answer is it is much more complicated in this current COVID environment. For those of you who don't recognize this is Columbia University's soccer stadium. You can see in the background that building is one of our Columbia University New York Presbyterian hospitals. I had the opportunity and the fortune to play at this field as a collegiate soccer player, and this is where I decided that I would serve athletes as a sports medicine physician when my soccer career was over in college. This is what it looked like today. It has a bubble on it to allow athletes to train during the winter. And because of its proximity to the hospital, and in fact, this is where some of our academy players train during the winter, and because of the surge of patients, this bubble was reconfigured to be a field hospital. It was quickly, with all the logistics you can imagine, changed to be a hospital setting, and now is taking care of over 200 patients that are ill and cannot be supported by our hospital systems because of the sheer number of patients that have had the COVID illness. Okay, let's talk about what I think everybody is most interested in now, and how do we return to normal? How are we going to get our kids back on the field? This is a model, it's a plan, it's preliminary, and of course it's potentially going to be changed because there's lots of issues. Consider that most important is we want to minimize infection risk. That's everything about social distancing. We need resources, we need fields, and we need to be able to do things on those fields. And many of these issues are going to be managed by our government. Consider what would make sense as a return to training. As we said, if you're coming off injury, first we start out small and we progress. We would do so in a phased approach in the COVID environment. And that is, if we're allowed to start training, it would be with individuals allowing access to a field. It would not be a high number of players. In fact, some have suggested a number 4 athletes for an entire soccer field. So, and then we would progress to small group play and group training, and then to full training, and then of course games. What would be involved in the early phases? Well, monitoring for COVID symptom signs have to be surveilled and monitored. So if a player has symptoms or has had contact with somebody who's had symptoms, that means no training. If a player or a coach or somebody involved has risk factors, such as a coach who's over the age of 65, as an example, has health issues, or somebody who has immune suppression, they should not be involved with training. And things like frequent temperature checks. You show up to training, we screen for your temperature, make sure you don't have a subtle indication that you have an earlier asymptomatic manifestation of COVID. Social distancing, as you know, and hygiene are one of our most powerful tools for controlling the pandemic. And so when we return to sport, we're going to have to institute in a sport environment the same social distancing and hygiene. So as an example, players may arrive and leave to training in a staggered fashion. They may wear a mask in the training facility, immediately wash hands when they enter, wear gloves when they're getting ready, using certain equipments as they're getting ready to train. And the number of players who could train initially will be dictated by your size of field and how many fields that you may have. As an example, we said it could be 4 individual players only for a single full-size soccer field. And of course, that's going to be challenging, and that would be mostly geared at skill work. Coaches could be involved, observing and coaching, but with appropriate social distancing, wearing a mask, etc. And then everything has to be sanitized after a training session before the next group would come in. As we progress, phase 2 and 3 training could be small group training, monitoring symptoms like we said before, implementing COVID testing if possible. And COVID testing, as many of you know, is based on either a nasal swab, which is a PCR technique, which takes many hours to come back, or antibody testing, which is an advanced way of testing for COVID because it allows you to know if you've been exposed to it, had it, and are recovered from it. And antibody testing is a blood test, so it's a little more sophisticated and it's not as readily available. So hopefully in the future, that becomes something that we can roll out to players who are ideal for this situation, which would be to test all players and staff. And then how do we time it? What's the frequency? Do we test prior to every training session, every week, every month? And of course, the availability of this testing is going to be challenging, especially in different sectors of the United States. New York being one of the highest concentrations of COVID, as everybody knows. And then we have to follow public health and government guidelines. Here's something that we're learning more about, and we're going to continue to learn more as time goes on. Cardiac issues are extremely prevalent in especially male young athletes and young males in general who have had COVID and had symptoms. It could be as high as 40%. Myocarditis is an inflammation of your heart. And if you return to play and strenuous exercise in the setting of inflammation at your heart, you're at risk for having an event, maybe even something that causes you to suddenly collapse. So this influences return to play. And at the highest level, at the professional level, there's lots of consideration if every player should be screened for cardiac issue and myocarditis before return to play. And that's also going to affect our collegiate athletes and maybe even trickle down to our high school athletes. So as we learn more, we're going to get more questions and more issues that we have to manage. So in summary, this safe return to play is extremely challenging. What I was hoping to offer is a planning approach to this. So when we do get the green light from government officials and we do have some policy in place, we do it in a safe fashion, because out of everything of all our responsibility as physicians, what we care about most right now as sports medicine doctors is making sure our kids can get back to play safely and enjoy going forward with their sport. Charlie, thanks for putting this together. And for all of you, here is my email. I know there's going to be questions, and as time goes on, I'm happy to accept emails. I anticipate that we're going to make a newsletter once more formalized protocols come into place, and we'll be happy to share those with you and please email me so we can get you on our list and we can send it out. Thanks very much.
Chris, thank you for a really insightful talk. I guess my first question after listening to your talk is it's got to be on the mind of a lot of parents. We got camps coming up, summer sports. Is it the right thing to sign your kid up for a soccer camp this summer?
You know, Charlie, that's the burning question right now because we want to make plans and we want to get back to normal. I think it makes sense to be optimistic that we're going to return to normal at some point and we should plan appropriately, but we also have to be realistic and understand that it may not happen. And so everything we heard about during the course of the webinar has been about working safely at home, knowing what to do if you do get injured. And as far as going forward with summer camps, I want to be in a position to roll it out with appropriate guidelines to patient and families as you do and everyone else. So I think we have to be cautious though. So the answer is, let's try to get ready, follow what happens on a day-to-day, week-by-week basis. So when we can start some level of training, or we can start some level of group activity with appropriate recommendations for everything we just went over, we're ready to do it, but safety first.
Fair enough. And second question is, you have obviously unique insight to what's going on in Major League Baseball. Is there going to be a baseball season?
That is a question that if I had the answer to, I would be happy to share it. So nobody wants to give up the baseball season, and so there's regular calls on how to manage the environment. So as of right now, it's being looked into extremely with extreme detail. And so I can tell you the issues are enormous related to baseball. New York is a challenging environment. Other destinations do not, other cities do not have what we have from a COVID perspective. So there's some thoughts about having neutral sites. And if you have neutral sites, how do you house players in those neutral sites, and then the economics of it? So it's a very complex situation. But I think we should all be aware that there's been no suggestion to date that the baseball season is over. And if it does occur, it's going to be in a modified approach. And one of the questions we have to wrap and get a plan on is, if we return, what happens if a player or a coach or a team starts turning out to have positive COVID tests? What happens with that team, and how do we manage that? Because the rules and regulations of players and injuries are strict right now. And we're not used to dealing with a COVID situation where a high number of players can get sick. So I know in Japan, they started their baseball league up, and then a couple of players got COVID, and then they shut it down again. So we have to be very careful of putting all this effort and all of this investment into starting a season and then having it shut down again.
Fair enough. Thank you for your time, Chris. I'm going to see if I can share my screen successfully, and we'll take it home here. I'm going to talk about early sports specialization, and if there's hopefully a silver lining maybe from this pandemic is maybe it will give some of the young athletes here in the tri-state area a little bit of a break, because it certainly seems like in a lot of instances, kids are playing sports year round. I really don't have any significant disclosures related to this talk, but I'm pretty passionate about youth sports. And youth sports, listen, the landscape has changed. The days of sandlot baseball and free play are gone. It's been replaced by the Little League World Series in Williamsburg, where kids are playing in front of thousands and millions are watching on ESPN. There's a lot of pressure for kids to excel, and really to excel early. There's very much a win at all costs mentality that has developed.
You ain't first, you're last. You know, don't talk about that phrase, trademark, not to use it as a tradition, Ricky Bobby.
Yeah, I feel like that's one of my favorite movie quotes, and I think it really does sort of sum up a lot of the mentality that this country has with regards to winning. Vince Lombardi, famous Packers coach, used to say, winning isn't everything, it's the only thing. And unfortunately, that has trickled down into youth sports, and it's led to early sports specialization. So when we use the term early sports specialization, how are we defining that? So first, you got to be in your sport for greater than 8 months a year, really at the exclusion of any other. And then when we talk about early, we're talking about kids that are less than 12 years of age. And what we're witnessing in this country right now is the professionalization of youth sports. Gone are the days of free play. We now have ultra organization. We've got travel teams starting as young as 6 and 7 year olds. And we're starting to see a split between what parents want and what parents hope to gain from their kids participating in sports and what the kids actually want when they participate in the sport. And unfortunately, this pretty drastic shift has come at a really high price to our kids. Really, we're starting to lose a lot of our young athletes. So what is the true cost of early sports specialization? First and foremost, injuries. For baseball, we're seeing record numbers of Tommy John surgeries being performed in kids of younger and younger ages. Current stats are in Major League Baseball, almost 25% of pitchers at that level have had a Tommy John procedure, which is pretty staggering. More importantly, at the kids level, sports just aren't fun anymore. And when sports are not fun, kids are quitting, and we're getting empty fields for other reasons. And there's this prevailing myth out there that early sports specialization is the optimal pathway. But when we think about that, the literature, when we look at it, is anything but. And a lot of this mentality came out of the thinking that, hey, we just want to get a competitive advantage. Malcolm Gladwell had that book Outliers, and in it they referenced a study that was done on musicians, and 10,000 hours seemed to be this magical number where if you hit 10,000 hours, you are much more likely to be elite. So the thought is, hey, you just start early, you get to that 10,000 hours, bingo, you're going to get there and be an elite athlete. And I'm not sure that the analogy holds when we're talking about sports. And if you want to talk about studies, time after time, study after study, it's showing that early sports specialization is not required for elite athletic success. In fact, if anything, it's the opposite, late specialization. The age magic number seems to be around 14 or 15 years old for almost all team sports. And some people like tangible examples. So for the hockey fans out there, Anders Lee, captain of the New York Islanders, is a 3-sport high school star. He's actually from my hometown in Edina, Minnesota. Some people don't know he was actually the Gatorade Player of the Year in football, and he was also a pretty good baseball pitcher and third baseman. He was also, of course, an all-state hockey player, went to Notre Dame, and has had a pretty outstanding professional sports career. For those Rangers fans, your captain, Chris Kreider, same deal. He was a dual sport star at Phillips Andover. He was all-state for soccer before focusing on hockey, and obviously that's done pretty well for him. I'd like to just switch it up a little bit and talk about another country's approach to sports, Norway, who, believe it or not, actually won the most medals at the last Winter Olympics in 2018. And if you look at their sports culture, it couldn't be any different than our country. So a couple highlights. They don't have any travel or elite teams until high school. Early sports specialization does not exist in Norway. They don't even keep score in most sports until junior high. And their overall sports participation rate is 93%. And for a country that doesn't even have 6 million people in it, those are some outstanding numbers and should give us some pause and something to think about with our youth sports and youth sports culture. So really quick, final pearls to take home. Early sports specialization is not required for elite achievement in sports. It has been associated with increased injury risk. It can unfortunately lead to burnout and a lot of loss of enjoyment in sports. a good number that we like to use and throw around, that there's actually some literature behind. Your young athletes should not be participating in sports for more hours a week than their age. That's a good benchmark to keep in mind. And then finally, when we ask the question amongst ourselves, can we make a difference as parents and coaches? The answer is absolutely. We did a study at Columbia looking at what were the factors driving youth sports specialization, and it's parents and coaches. So we got to spread the message to you first. So in summary, listen, youth sports is supposed to be about free play. It's supposed to be fun. You're supposed to get out there and be active. There's a fitness component. And then I think it's really important for social development. I think we're going to create a lot healthier athletes if you specialize late. So just food for thought during this pandemic. Make sure we're having some late specialized kids and not throwing all your eggs in one basket. So that's our webinar. I think we'll open it up to questions.
Dr. Popkin, great talk. Thank you so much for sharing, and your passion for sports specialization, I think, is palpable. There's a question from the audience here wondering, with sports specialization, obviously some sports need it earlier than others, and do you see certain sports having a higher prevalence of injuries because of this?
Sure. Two-part question. So there are some what we call early entry sports. So if you want your kid, or your kid is passionate about, say, gymnastics or figure skating is another one. If you're starting that to specialize at 14 or 15, I think you're going to have missed the window. So those statements do not necessarily apply for those early entry sports. And then with regards to injuries, we see that in a lot of the sports. I referenced the example in baseball with Tommy John. Certainly women's soccer, we're seeing an epidemic of ACL injuries. And then in young hockey players, we think there's a version of, it's kind of similar to like an Osgood Schlatter or an overgrowth of the apophysis up around the hip, because, goaltenders and a lot of the skating position is certainly stressful on the hip. So that has been associated with increased hip injuries in the young hockey players. So it's kind of sport specific to answer, but almost across the board, if you're specializing early and violating a lot of those rules, certainly putting yourself at increased injury risk.
Dr. Desai, there's a question for you from the audience about the future of cardiac screening in athletes, and if you think there's any potential increase for us to see athletes with myocarditis with COVID.
Yeah, definitely. So as Dr. Ahmad mentioned, that we're actually seeing a high prevalence of some sort of cardiomyopathy or myocarditis after COVID infection, as in some studies as much as 20%. So one of the things that is currently being discussed amongst team physicians, both at the professional level and the collegiate level, is how do we appropriately screen these patients, these athletes. So there was in BJSM, there was a post just put up. It's still being verified, but the initial recommendations put out by the team docs for a lot of the national organizations. And one of them, it's basically a stepwise progression. If they've been diagnosed with COVID at any point, to get a screening EKG and then escalate testing from there. If they've had more significant disease with COVID, to actually get higher level of testing like an EKG, echo, even a cardiac MRI. So it's definitely going to be a work in progress. We don't have clear guidelines, but I know the American College of Cardiology is coming out with guidelines soon, and there'll be a lot more to come from team physicians. So it's something we are looking into.
Okay. It seems like there's another question here about how young we're seeing girls with the female athlete triad. I guess in my office, I've seen it as young as 13 or 14. Dr. Redler or Desai, do you want to chime in on that also?
Yeah, I mean, especially today, I agree that's probably true for an average. I've seen obviously lots of girls with some early puberty, as I think a lot of us are seeing in our offices too, and have seen it as early as 12 years old is probably the youngest I saw.
So I think also, it's female athlete triad, you could have elements of the triad without having all three. So, you know, you could have energy deficiency much earlier before you actually get injury to the bony stress injury. So yeah, I would be on the lookout for it as soon as kids are starting to specialize in sports and have high energy expenditures to make sure they're having enough caloric intake.
Okay.
Dr. Popkin, there's a question for you from the audience about sport specialization, and do you see a benefit in choosing sports that have similar movement in kids, or should you try to diversify the activities with different body parts and different movements?
Great question. I read a really good article that was sort of highlighting Pat Mahomes. Is obviously he won the Super Bowl, and his dad was a pitcher for the Minnesota Twins. So he was a football, baseball guy growing up. And I think if you are picking an additional sport, it's nice if you do one that can be complementary. So in that setting for him, those were like two anticipatory type sports that led him to have better anticipation on the football field. There was a running joke in New York for a while that the best soccer player was actually on the Yankees. It was Mariano Rivera. Similarly, during Charlie Ward's time with the Knicks, the joke was that the best quarterback was on the bench for the Knicks in the New York area. I think you can combine a lot of different sports. I think it probably makes sense, like for hockey guys, to do something more with like lacrosse or say golf, where you're getting a lot of those maybe same motor skills. But I think the nice part about putting eggs in different baskets is you can learn different aspects from those different sports and apply them. And then most importantly, if you're doing different sports and you're not throwing all your eggs into one basket early, you learn the most important thing, which is just how to learn in general.
Great point. I think athletes can really take a lot from that about learning how to be an athlete and learning how to learn sports. Dr. Ahmad, we have a question for you from the audience about athletes like gymnasts who often use shared equipment and require their coaches to be able to spot them. So a lot of physical contact. And do you have any thoughts on how to safely return them to their sport in the post-COVID era? Dr. Desai, do you want to take that one as our resident gymnast expert?
So just to repeat the question, it was how do we mitigate risk in sports that have multi-use equipment? Multi-use
equipment and high-touch interpersonal with coaches required for things like spotting.
Yeah, so I mean, that's one of the things that we don't have like the perfect answer for. I think decontamination is going to be the biggest thing, having good hand hygiene, the close contact between the coach and the athlete. Ideally, we would have had some immunization either by a vaccine or known antibodies that would give us the most safeguards to know that we're safe sending our athletes back to these type of environments. But I think the guidance right now, once things open up, we're going to have to really respect things like symptoms and being very cautious, keeping athletes home, keeping the coach home if anyone's feeling sick. But again, it's not a perfect answer. I think that decontamination and really strict guidelines on how we interact, and maybe coaches have to wear masks or something like that. I think it's going to be a little bit of trial and error there.
Awesome, thanks. And something else just to make a final point, we're focusing on young athletes and young kids, and I think we all have to remember that although COVID is widespread and devastating, that so far statistics are showing that kids are not getting such severe infections, and that this might not be such a huge thing to think about for this patient population, especially young kids, but something, of course, that's on all of our minds. So thanks to Dr. Popkin for organizing and for everyone else for being here.
Yeah, everybody, thank you for spending your afternoon with us. I hope you found that informative, and we'll put the talk and the PDFs on the website. Thank you very much for coming.
Thanks, guys.